So in just a minute, we'll get started. Thank you for joining us this morning. So again, I see we have 23 participants. We're going to get started in just a moment. Thank you for joining us. I'm sure this is going to be a very interesting conversation. So we're just reaching 9:30 now. In just another minute or two, we'll get started with the state of education now, the challenges of K through 12 education during the COVID-19 pandemic. Thank you for joining us. We're going to wait just a couple more minutes. Okay, I can see that the participant numbers are increasing. We're just going to wait one more minute and then get started with our conversation. I'm sure this is going to be a very interesting exchange, and we very much look forward to your questions. So just one more minute. Okay, everyone, thank you for joining us. So good morning. Good morning. Thank you so much for joining us. Welcome. My name is Bridget Long, and I'm the Dean and Sayers Professor of Education and Economics at the Harvard Graduate School of Education. I'm glad to be here today to discuss the challenges of K through 12 education that have been created by the pandemic, really created and exacerbated, with special thanks to the Harvard University Office of Federal Relations and to Education Now, which is a broadcast series at the Harvard Graduate School of Education. And thank you to all of you for making the time to be here today. My colleagues and I are looking forward to speaking with you, but first, a little housekeeping. While today's conversation is just for congressional staff, this briefing will be recorded and will be available online to watch again later. Please also submit your questions through the webinar using the Q&A button at the bottom of your Zoom screen. You will also find closed caption access there. And now I am delighted to welcome my colleagues. First, we have Joseph Allen, who is Associate Professor of Exposure Assessment Science and Director of the Healthy Buildings Program at the Harvard T.H. Chan School of Public Health. And second, we have Paul Revel, a colleague of mine at the Harvard Graduate School of Education, where he is the Francis Keppel Professor of Education Policy and Administration and the former Secretary of Education for the Commonwealth of Massachusetts. We are going to each begin with 3 to 5 minute opening statements before launching into our conversation and then reserving time towards the end for questions. So I'm going to start with a little bit of an introduction and framing for our conversation today. I want to start by just reflecting on some of the key lessons and takeaways that we have learned thus far with the challenges we've faced in the K through 12 system due to the pandemic. As we've seen in the last 7 months, we've quickly had to face new realities and throw out old assumptions. This has not been a time to rely on our usual norms and practices. The other thing that has been quite important is the urgency, the utmost importance of time and being proactive. As we have seen in varying outcomes with the schools that have been the most proactive, the schools that have faced the fact that our realities have changed and that we had to throw out old assumptions are the ones who have been most successful in addressing student needs. The other thing that has become clear is that our K through education system really goes beyond academics to many, many other parts of society. Our schools are more than just physical buildings that provide academic content. They also provide regular access to food and healthcare. Our educators do more than just stimulate minds. They also provide social emotional support and safety in terms of adult supervision. Our community-based organizations, which oftentimes get left out of the conversation, are important in that they're interwoven with our schools to provide activities, support, and again, adult supervision for our families. And so they are essential to addressing student needs. And of course, we've known that there have been gaps in equity and access. What COVID has really underscored and really shown is that equity and access to educational opportunity is even more critical in this rapidly changing world, and we are seeing differential effects. So what we are confronting this fall is students arriving back to school with very different spring experiences. And so there is a great deal of variation in what they've learned, what they've retained, and what their learning needs are as they arrive and have started this fall semester. And student mental health and the need for social emotional supports is also absolutely critical. So during this conversation, I hope we can spend some time thinking a bit about the role of the federal government in addressing these needs. I'll make two brief points before passing on to my colleagues. The first is data are essential. They're essential for monitoring, for learning, and for decision making. And this includes not only health data, but also school plans and innovations, emerging best practices and lessons learned. And the federal government is uniquely situated to be able to play a role in the collection and sharing of this information to help provide guidance and again, share those emerging best practices of what some schools are figuring out in some communities, but not others. So we need information also to assess current needs, to determine the scale of the problem, identify the particularly worrisome problem spots, and then also set priorities about how to invest our limited resources. Which brings me to the very important point about resources. Several things to consider as we look forward. One is that we need to adapt our systems to match the learning and support needs of our students. This may mean incentivizing innovation with certain kinds of grants, certainly thinking about how we can use technology not to replace teachers, but to supplement and to personalize and address the learning needs of students, which are so varied, as well as thinking about formative assessment so we have a good understanding of what students' needs are. We also need to think about increasing learning time, going back to my first point about we can have to throw out old assumptions. Now with many schools being remote, we don't have to worry about bus schedules and travel. We can adopt a new mindset and we do have to think outside of the traditional box about learning time because in order to catch up students, in order to make sure that they're making progress, given all of the stresses, we do need to think about ways that we can increase learning. And a third thing is to think expansively about educator capacity. This is not just about teachers. It is also about school counselors who are needed for mental health supports, learning specialists, teaching assistants, and of course, school nurses. And beyond that, going back to our community-based organizations, partnerships with other organizations are essential for schools to be able to provide their services, whether they're after-school programs, tutoring, and this is a way to actually involve older students, college students, to give back to their younger counterparts. So I'm going to end there and hand off next to my colleague, Joseph. I'm wondering if you could share a few thoughts on what communities should be prioritizing when it comes to the health of their schools and their buildings.
Yeah, thanks, Dean Long, and good morning to everybody. Pleasure to join you. I share Dean Long's opening comment on the need to treat this with urgency. It's a national emergency when we have so many kids out of school. So I'm on the faculty of the School of Public Health, and I direct the Healthy Buildings program. My expertise is really in the field of exposure and risk science. So I'm a certified industrial hygienist. This is the field that anticipates, recognizes, assesses, and ultimately controls hazards in the workplace, be it radiological, chemical, physical hazards, and in this case, biological hazards. I'm a commissioner on the Lancet COVID-19 Commission, and I chair the task force on safe work, safe schools, and safe travel. But what's most relevant, I think, to what we're seeing right now is prior to being at Harvard and still now, I was in consulting and I advise organizations around that are facing sick building issues. This is everything from disease outbreaks in hospitals, cancer clusters in schools. Many of these were very serious. People had died in buildings and everyone else was at risk. And so while this pandemic is unfamiliar to all of us, there are aspects of it that are actually quite familiar. That being, we know how to assess hazards and we know how to put controls in place to keep both kids and adults safe, be it in schools or any other work environment. So I've been advising many organizations across really the entire US economy, from corporate sector, finance, biotech, pharma, to community childcare centers, K through 12 schools, universities. And fundamentally, we start with the same principles. How are we exposed to this virus? And then you line up the appropriate controls. And we know there are 3 modes of transmission. I can talk about this more in the Q&A. Close contact, contaminated surfaces, or what we call fomites. And third is airborne transmission. And this third one hasn't gotten a lot of attention. My field has been screaming from the rooftops about this since February. CDC has just finally turned the corner on this. But airborne transmission is happening, and that simply means there's exposure and risk beyond this 6-foot buffer. Now, we've long known that buildings can play a key role in the spread of disease or in keeping us safe. If we look most recently at the 2 other coronavirus epidemics that were near-miss pandemics, SARS and MERS, we have examples where buildings aided in the spread of disease. In fact, SARS-1 was seeded by 1 person in a hotel who infected 16 others, who then went on to back to their own countries and seeded additional outbreaks. So 1 person in 1 hotel on 1 day seeded a global epidemic. Key strategies, well, that means is that healthy building strategies like higher ventilation rates and higher filtration are key to controlling exposure and risk in schools and everywhere else. In addition, with source control through masking, universal masking is a must. I want to put healthy buildings, though, in a wider context of holistic risk reduction. We think about a layered defense approach, and there are other techniques we can use to reduce risk, like administrative controls, PPE, the mask wearing, the engineering controls. And maybe most importantly, and I'll end my comments here, is that we really need a wider lens on risk. My view, the conversation on risk has gotten very reductionist in terms of risk in the classroom to COVID-19. There's a wider risk happening, in particular, the devastating costs of kids out of school. We have virtual dropouts. Tens of thousands of kids are unaccounted for all across the country. This has been going on since the spring. We have less socialization with kids. The learning is disrupted. Over 30 million kids in this country rely on schools for their meals. And UNICEF reports that kids who are out of school are more likely to suffer from abuse, neglect, exploitation, and violence. So while we can control the risks in the classroom, I'm confident we can do that with the appropriate resources, and I'm happy to talk about what I think those should be. There are these other risks that are happening right now. And while cases in schools are the headline story today, the future public health stories are writing themselves right now. And we are going to see these effects for many years. So thank you. And I'm looking forward to the conversation.
Thank you so much. So Paul, I wonder if you'd like to share a few comments about what's happening with schools, families, and students.
Thank you, Bridget. I appreciate the opportunity to be here, and thank all of you in the audience for, we talk a lot about how educators and communities, families, and students need to adapt to this crisis. Policymakers need to adapt too. And this is, I think, a particularly challenging moment to face up to these challenges and think through policy in ways that are perhaps unprecedented in terms of the work you do, and very challenging. So we're appreciative of your willingness to step up to that. I thought I'd zoom back out to kind of 30,000 feet and use my time to just talk with you a little bit about how I see the larger challenge here and some of the opportunities that go along with it. So I thought I'd begin by sharing 4 images that have been meaningful to me in trying to grapple with and understand what's in front of us right now. The first is that famous Chinese character for crisis, which includes a figure for danger and a figure for opportunity. We're well aware of the dangers, and we'll talk about those at great length today. They're obvious. They're not only in the field of health, but in the field of our economy and jobs and things of that nature. Pretty front and center in terms of our day-to-day life. But there are also opportunities. And there's a lot of talk and many groups seeking to take advantage in both a positive and in some respects negative ways of the opening that this gives us for transformative change. So I want to come back to that. Second is a Chinese character for education, which involves really kind of knowledge and relationships at some level, to educate, to raise, to bring up, to give birth to. And that sort of soft side, if you will, of education is something that in some respect we've lost sight of, and the importance of relationships in this time of deeply fractured relationships is something that I want to come back to and emphasize. An image I've also used is the image of the Sputnik, in the late 50s, when the Soviet Union put up a satellite well before the United States was ready to do that, and shocked us here in this country. And it had a profound effect in Washington, D.C., where the federal government decided it might need to get much more deeply involved in public education and K-12 education than ever before. It was a turning point, and we've seen other turning points, the Nation at Risk report, for example, since that time. But the Sputnik moment was a transformational moment that I think is like this moment if we take full advantage of it. And finally, the fourth image is that of a tidal wave. A tidal wave pulls back the ocean from the ocean floor and reveals what's on the ocean floor. I think the general public has developed this sense of urgency that Bridget was describing earlier about the deep, persistent inequities that were revealed in the lives of children and families on that ocean floor. Those of us who have the privilege and the opportunity by way of our work to work with those families and to work with those children are well aware of those inequities. Things that touch on factors outside of school as well as on education, food, clothing, shelter, stability, environment, housing, things of that nature. And I think that this wave and this revelation creates public attention and an opportunity to do something about those things that we haven't had before. So I see us in this moment as having a couple of challenges. One is to stabilize the existing situation. It's tantamount to an earthquake, what we've experienced now in the education sector. And we're just coming out from under the rubble, dusting ourselves off and beginning to move forward to communicate with one another, to restore some element of normalcy without making what would be an unwise commitment, in my view, to return to the status quo ante, which wasn't working particularly well anyway. But we're in the early stages. We're still traumatized. You don't ask a patient who's just had a heart attack and is on a gurney in an emergency room to change his lifestyle at that moment. He's got to get well and get up and get out of bed and get back into life before you can think about change. I think timing and leadership is going to be crucial in terms of taking advantage again of this opportunity for transformational change. I did a little paper for the CDC a while ago in which I sort of outlined what I thought were a handful of transformational change possibilities. And I'll just conclude by listing for you what they are, and we'll go into them in greater depth. First of all, we need to close the digital divide. We need your help in Washington on this. We can talk more about that later. We need to get everybody the technology they need and the connections they need to embrace this technology and make it part of education. We have been a reluctant sector with respect to technology, and virtually, literally overnight last March, we were catapulted into the world of educational technology, even though we weren't ready. Second is the personalization of education. I think that this moment, this pandemic, gives us the opportunity to change the one-size-fits-all factory model, teach to the average paradigm in education, and shift to a differentiated case management model where we meet children where they are and give them what they need. And this involves the time that Bridget talked about earlier. Not everybody needs the same amount of time right now because of the differences in gaps that have appeared as a result of this. We need to, third, connect families and communities to the work of education. We've given lip service to families for a long time, but suddenly they're now at the center. They truly are the first and foremost educators of their children, which we said in our rhetoric, but didn't really believe in our school operations. So this connection with families, if one size fits all didn't work well for students, it works even less well for families. So we've got to concentrate on that. Building relationships, number 4. We've not structured our schools, particularly our secondary schools, to incentivize, build, and grow the relationships part of the education equation. Many students still go through our secondary schools anonymously, and that's just not acceptable, particularly in this moment of fractured relationships. 5th, attention to poverty and equity concerns, taking a holistic look. That's, after all, what Title I was originally set up to do. We need to dig deeper. Full service community schools, promised neighborhoods, safe and supportive schools, thinking 360 degrees about our children. I think one thing we've proven, this may be controversial, but it's my belief as somebody who is deeply involved in school reform for the past 20 or 30 years, and we've done well in Massachusetts, is that schools alone can't do the job of creating an equal opportunity society. So we've got to expand our notion of the support, opportunity, and formal education that we need to give young people if we truly want to give everybody an equal opportunity to be successful. Finally, two last ones. Deepen our curriculum, make it more applied, make it more student-centered, make it more project-based. Teachers need help with that. And lastly, early childhood education, which is something that we've been talking about for a long time. Very high return on investment, something that we need to make accessible, and we need to improve quality and the support for people who teach in that sector. So I'll stop there, Bridget.
Great. Thank you so much. And so now we're going to launch into a bit of a discussion conversation before we'll be opening it up for questions later on during our session. So please do use the Q&A function in the webinar bottom bar to submit your questions, and we'll be sure to get to them a little bit later. For our conversation, we're going to organize it first dealing with lessons from the past, then focusing a bit on the present and the pain points, and thinking about the future. So to start, Professor Allen, I wonder if you could comment a bit on what have we learned thus far? Are there things that we've gotten right that we want to make sure we continue and build upon?
Yeah, so really important question. I'd say, what we've learned is something that we've actually known for a long time, but maybe a lot of schools are just confronting for the first time, is that our school building infrastructure has been neglected for decades, in particular, this question of ventilation. So again, if you think about airborne transmission, when a viral particle enters the air, it's going to be removed in one of two ways: diluted out of the air through ventilation or cleaned out of the air through filtration. Well, we've had years of neglect in our school systems related to the building infrastructure, and study after study across the United States shows that schools are chronically underventilated. And I'll put some numbers on this. Typical building that you're in most of the day will have carbon dioxide concentrations under 1,000 parts per million. We're the main source of CO2 indoors, and that's a good proxy for ventilation rate. Well, schools average 1,500 parts per million across the US, study after study, chronically underventilated. And if you look at the current ventilation standard, which gives you about 3 air changes per hour, and I can talk about what that is, most schools on average have 1.5 air changes per hour. So they're meeting about half of this ventilation standard. More importantly, this current ventilation standard is a minimum standard. It's not designed for human health and flourishing and productivity or disease transmission. It is a bare minimum, essentially ventilation standard set for things like odor control. So not only do we have a minimum standard that's not designed to promote health, schools aren't even meeting that minimum standard. And most schools right now are finding out that their systems just aren't capable of providing these higher levels of ventilation and filtration that are necessary to reduce the risk of disease. So I think many schools are learning that. It's an old lesson we've known in my field for a long time, but as they start to kick the tires on their ventilation systems, finding out there's no resiliency built into these systems, they can't adapt to this current crisis.
Okay, thank you. Paul, I want to go to you. Are there lessons that we've learned from spring and summer, things that we want to make sure we continue and build upon?
Yeah, I think so, Bridget, and you touched on a few of them in your remarks. I mean, I think we've learned during this crisis that resiliency matters and resources matter. So, of course, that favors those who have resiliency and resources. And if we've learned anything most vividly in this crisis, is that it's an equity crisis, that opportunities while they were unevenly distributed prior to the COVID-19 crisis, are even more unevenly distributed now. So the gaps are exacerbated and growing. That differential between students is now, you can't really ignore it. You can't teach to the average because there's nobody in the average. There's just a very wide distribution. So adaptability has been crucial. Those schools who we've seen do well in this crisis are schools that have stepped back, taken a larger view of what's happening, and decided and had the nimbleness and flexibility to change their standard operating procedures and their approaches. And a lot of our mainstream school systems, larger bureaucracies, deeply embedded standard operating procedures and union contracts in many cases, have not had the flexibility to adapt. I think of this past summer, for example. You saw a lot of charter schools, independent schools using that summertime in ways to gear up and get ready for opening school in the fall. And a lot of our mainstream schools didn't have the resources or the flexibility in terms of terms and conditions to be able to assemble adults and do the kind of professional development that we needed. So I think that's important. Last point I'll mention is there are moments in this where the interests of adults and the need to protect adults, which are perfectly legitimate, conflict with the interests of children. Joe's been talking a lot about the importance of bringing children back to school. And mediating that, I think, is difficult work to do. In general, adults are better organized to advance their interests than children. And we've seen some conflicts. We've seen significant reductions in time in some of our cities where, teacher contracts and side letters have been renegotiated in ways that actually reduce significantly teacher time with students. And this is a problem for students and families. And so balancing this and finding the flexibility to meet children where they are and give them what they need, I think is the biggest challenge we have right now.
Okay, thank you, Paul. Yes, I want to underscore something that you just said. It's not just resources; it's been flexibility. And as I said in my earlier comments, being proactive and seeing very early on, we couldn't have business as usual. I do want to go back to Joe, and I wonder, are there examples of schools, communities who seem to have gotten it right, and what did they do?
Yeah, it's a great question, Dean Long. And there are, and it's exactly like the problem is exactly what Paul said, is that if we talk about these disparities in ventilation, or I should say, that we're not even meeting these minimum ventilation targets, then the disparities widen when you look at communities of color and low-income communities, where maybe most schools on average meet half of that ventilation rate. In these lower resource schools, we're seeing maybe they meet a third of it. And this is, again, across the country. And so there are some school districts that are doing it right. I've had many superintendents reach out to me and in early June, when we released a 60-page report on risk reduction strategies for school, they went down and made a checklist and started asking specific questions on how this can be done. And they've been quite successful because I think there've been a lot of roadblocks set up, or a lot of thinking that says, our system is old, it can't do X. What I've learned through these forensic investigations of sick buildings I've done is that there's always something you can do. And our team has continued to release guidance every couple of weeks since June on simple steps nearly every school can take. We've been out at schools measuring ventilation rates to show that even opening up the windows 3 inches can give you 5, 6, 7 air changes per hour. We've shown that even looking at your existing system, as imperfect as it might be, if you just open the dampers a bit more, bring in more outdoor air, most schools can do this to some extent. Looking at your systems, increasing the level of filtration. So there are a lot of schools that are actually doing this. I've been impressed. They're being flexible in terms of use of outdoor space, especially in this early part of the, before it gets too cold. And right now I see good leaders in these schools already planning for the winter, right? this time when it's gonna be the depth of winter, particularly where we are in the Northeast, thinking about when we're gonna have to shut the windows. Well, what do you do? Well, there's always a strategy you can do. You lose a little bit of the ventilation issue, but you can put in things like a portable air cleaner with a HEPA filter in classrooms to give you that filtration. So there's actually a lot of success stories out there. And I think it speaks to one of the biggest challenges we have right now is that it's hard to find the data on the success stories. The cases are coming through. The New York Times is tracking cases very well, but without collecting the data on what controls are in place or what controls are not in place. So we're losing the ability to learn from what's happening here. And the cases rise to the news, but we don't see the successes. And we've seen many of these through the spring, through the summer, and now even through the fall. And we need to learn from those. And I think this is an area where the federal government could step up and provide these resources to start tracking systematically what's happening at each school in terms of the case of the controls, so we can learn best practice and then disseminate that widely.
Right. Thank you, Joe. Yeah, I really want to underscore something that you just said, the fact that there are some successes. And goes back to the point I said earlier about the importance of data and the unique position the federal government has. You know, we have hundreds of thousands of mini experiments going on around the United States that are happening in quick succession. And some schools are figuring it out. Some are being very proactive, are trying different things, are innovating, and are actually getting good results. The problem is coordination and sharing that information. And so this is one of the many roles that the federal government can do better than anyone else. I say this as former chair of the board for IES, for the National Board of Education Sciences, and the important role of sharing information across schools. You can also say at the Harvard Graduate School of Education, where we spent some time connecting principals to talk to each other so that they can share these practices and share what's working as well as what is not. And to Paul's point, to build off what he said earlier, this is a moment in time where there is a great deal of innovation. And a big concern is a few years from now, will we have lost these really valuable lessons about ways to make gains? And the only way we're going to be able to do that is with a serious prioritization and emphasis on actually collecting that information, sharing that information, engaging researchers, engaging families and communities to understand, where we are seeing success, that we don't have to reinvent the wheel and everything. But moving forward, I want to talk a bit about the present and ask both of you, what do you think is the most pressing issue right now that we must immediately address? Paul, I'll have you go first.
Well, it's hard to answer that in the singular, Bridget. I guess at the top of my list is disconnected students and families. I mean, right now we're living in a remote world for the most part in terms of how we're conducting education. And we have many students who are off the grid altogether. And we have then many more who are maybe sort of technically connected, but totally inadequately supported so that they're not able to derive anything like real present value from what's happening and what's being communicated to them. So I'd emphasize that. I can't help but use the opportunity to say inadequate resources. I mean, a hole has been blown through state and local budgets, and we desperately need your support in terms of filling that hole. Schools are being asked to do more, even if they had a level budget, they're being asked to do more now with less. Everything from PPE and all the things Joe's been talking about to some of these transformative changes that I've been talking about. And they have less money to do it. So that's a critical problem. And there's a long list of other things, but let me start with those two: disconnected students and inadequate resources.
Inadequate resources. Just to underscore that, and I think this may even build and help build what Joe may say with the resources. Typically, so I've studied recessions and the impact that they've had on education in the past. Typically, there's a bit of a delay. Recessions, you start to fall in terms of employment, in terms of earnings, in terms of tax revenue, but there's a bit of a delay before it starts hitting state revenues or even federal revenues. And so school districts at least have a little bit more time to foresee what's on the horizon and to make adjustments. COVID has been completely different. It has been instant, it has been dramatic, it is impacting revenues immediately. And so the fears that we had, and as we watched over the summer, with a number of districts not being able to retain their full staff at a time when student needs are at their highest. So this is different than previous recessions that we've seen in the immediate need of resources given the impact that the pandemic has had. And I think this probably also goes to infrastructure investments. So Joe, what do you see as the most important pain point right now that we need to immediately address?
Yeah, so I'll stick to the exposure and risk side on virus and disease transmission here. What I'm seeing is simply access to guidance, right? It still amazes me that in October, I'm still answering calls, just my team with schools that say they haven't seen the guidance, or somebody tipped them off because we tweeted it out that they found our guide that we put out in June. So this guidance is out there. We have tools for parents, how to select portable air cleaners for your school, the science behind this, tips and tricks for keeping kids and adults safe, and really detailed guidance, but it's not reaching enough people, right? We're reaching thousands and thousands, but I still see people not getting this guidance and they're not sure where to turn. And that's important because I think one of the biggest challenges in this pandemic has been the overwhelming amount of information coming out of people, and it's hard to decipher the science and what trusted resources are. And there's been a gap here that can be solved through the federal government in terms of delivering this guidance consistently. The second thing that I think can be done right now, we made a case for this in an op-ed in August, is the federal government sponsoring a portable air cleaner in every single classroom. We estimate it'll cost $1 billion. Here's how a portable air cleaner works. It has a HEPA filter in it, and as it will capture any airborne viral particles, 99.97%. If you size these right for the room, and we've delivered guidance on how to do this, simplified guidance, you can get this 4 to 6 air changes per hour. Let me put some context on air changes per hour. Typical home in the United States has half an air change per hour. It means it takes 2 hours for the full volume of air in that room to dilute. At 4, 5, and 6 air changes per hour, you're getting the equivalent of turning over that air every couple of minutes, 10 to 20 minutes, depending on the room. So this can go a long way. This is simple technology. It's been validated, peer-reviewed, it's evidence-based. And as we move into the winter, this can go a long way into solving some of the short-term problems with existing infrastructure in the building. This is plug-and-play technology, stopgap, while we put in the real hard work in fixing school infrastructure in a big way. And last, I'd say, so first is access to the guidance, two, the immediate need for addressing this filtration question. And third is consistent messaging, right? All of a sudden, well, not all of a sudden, simple steps like universal masking have become politicized. I hear from teachers who say they went out and bought a portable air cleaner for their classroom and they're not allowed to even bring it in. So this got the messaging out there on these, the power of non-pharmaceutical interventions, the basics, hand washing, mask wearing, ventilation, filtration, has not been distributed consistently. So there's confusion out there in terms of what's allowed and what's not allowed, when we know these work and can drive down risk and help get kids back into school as a stopgap while we do the longer, harder work into fixing our schools with a more holistic strategy.
Okay, great, thank you. Let's talk a little bit about the trade-offs. So Paul, one big concern that many people are worried about is learning loss. What do we know thus far about learning loss? And Joe, to give you a little bit of a preview, how do we balance these risks, learning loss versus safety? Paul?
Well, I said last spring, as we began to contemplate the end of the last school year, and virtually every district in the country decided that they were simply going to, in spite of the learning loss that had occurred in the last quarter of last year, socially promote effectively all students on to the next grade. Now, we've always had gaps as people move from one grade to another. There was a distribution of achievement, as you would expect in any class. But again, those gaps got wider than ever before. And so we know the learning loss is deeper in some places than others. And this is, to my earlier point, what I think is the straw that breaks the camel's back on one size fits all. We've got to develop more of a case management approach comparable to what we do in the healthcare industry, where we do a diagnostic for each child, and those diagnostics are going to be widely different. So schools need to develop the capacity, teachers need the training to develop the ways and means of reaching out to children and families and find out where they are, what assets do they have, what gaps do they have, and how do we as adults get ourselves organized in order to help them move from where they are back to an acceptable standard. These gaps are growing by the day, literally. And so we've got to differentiate our approach if we have any hope of closing these gaps. And it's about capacity. And it's not just a teaching and learning problem. It's also, I mean, several of us have commented on the role schools have played in treating issues that are basically non-education issues, whether it's nutrition or mental health or healthcare, issues that compassionate educators know make a huge difference in terms of what schools can achieve. But really, these institutions we call schools are inadequately resourced to have the capacity to be food agencies or mental health agencies or health agencies. So this means we've got to have a wider conception of not only how we operate and try and operate in an integrated, family-friendly way, but how we make policy and make government investments. HHS needs to be linked much more tightly to the Department of Education in terms of the work we do, so that we build the capacity of schools to treat these impediments that arise outside of school that have always been there, that get in the way of young people getting to school in the first place because they're in a trauma-filled environment. And so mitigating those circumstances are something that requires our attention now from a policy and investment standpoint.
Sure. Before we go to you, I do want to start bringing in questions from the Q&A. So please do submit your questions. Paul, there's kind of a follow-up question to you, and that is related to resources. What are you seeing in terms of the impact of the squeeze on state budgets and affecting what schools are able to do? And are you seeing any sense that federal COVID relief dollars are helping or not?
Well, there's no question that the CARES Act was helpful and was a good stopgap that helped schools get through the last quarter last year. And for the most part, they did reasonably well at coming through that period. There were some savings in certain areas. There were definitely increased costs, which typically outweighed the savings, but it was manageable. As they look at this year and how they're going to get through, people are on pins and needles because, frankly, they don't know what the federal government is going to do by way of the HEROES Act and whether or not that's going to be coming through, and then how the general budget might look different for the coming year. So there's a lot of guesswork going on, and school districts are forced into contingency planning, and they have several. They have an A plan, a B plan, and a C plan. And they're trying to protect themselves, and they're trying to, at the same time, protect their people. We have professionals, we have educators, we have all kinds of staff who work. And, I know of instances in which, commitments have been made via contracts to fund, bus drivers for the entire year, whether we need them or not, because the community wants to support those people and maintain them in place, while at the same time they're having to cut back on services to children because they don't have the budget to do it. So the pinch is being felt at the local level. And the dominant theme right now is one of uncertainty and therefore cautiousness in budget expenditures. So not doing the extra reach that you might have to do in order to be adaptable and start working differently to meet the needs that appear in this crisis.
Yes, and I think one thing that is implied by what you said, Paul, that I want to underscore is it's different when it seemed like it was a blip. It was a temporary problem that we had to solve before we could go back to normal. What's clear now is this is a long-term situation and circumstances. We're now seeing cases increase around the country. Boston here locally, just having to go remote because of cases going up. So it is a very different circumstance when you are trying to fund for a short-term problem versus what we are in right now, which is a long-term sustaining program.
And
so
I will
moving,
say, Bridget, in that regard, I'm getting more and more inquiries from superintendents and school boards, about planning for 21-22. In other words, they're thinking this is not going away. There are going to be residual factors no matter what. And what should we be thinking about as we're thinking about 21-22?
Okay, Joe, I want to bring you back in the conversation. So how do we balance these risks, these trade-offs? Um, Thoughts on that?
Yeah, well, you and Paul have laid out, the devastating consequences here and the widening racial and ethnic gaps, and also the widening gaps in gender disparities, where we see women dropping out of the workforce in record numbers against the risks in the classroom. And I think it is worth talking about what we know in terms of risk. And we'll start with kids and then get to adults. But this virus has not spared us in many ways when it comes, in many ways at all, except when it comes to kids. So mercifully, the data are really quite consistent that kids are lower risk of catching this virus. And we're starting to understand why. I can talk about why that is in terms of the receptors and gene expression, and why this virus is less likely to latch on to the receptors in kids. They're less likely to die from this by a lot. We look at the numbers compared to past years, and the excess mortality rates that have been in the news lately have been shockingly high, except for kids less than 25 years old. And if you look at deaths for kids under 18, it's on the order of 3 in 100,000. So that's 10 to the minus 5 risk. That's quite low. Now it's extraordinarily high for those who have pre-existing conditions and as you get older. Third, it looks like kids are less likely to transmit this virus. So if you take all of that in terms of the exposure, remember, wide lens on exposure here, kids are at much lower risk. And in terms of kids and adults in the classroom, we know these non-pharmaceutical interventions can work. How do we know? Best evidence is from the healthcare sector, high risk environment. How are they controlling risk? They've really driven down risk to healthcare workers. It's the basics: hand washing, consistent mask wearing, healthy buildings, ventilation and filtration. They cannot physical distance at the hospital. And still they've driven down risk. So we know these controls can work. And so if we think about that risk inside the classroom against the risks of all the risks you've laid out for outside the classroom, we have there are ways to get kids back into school and alleviate those external risks. We can do it. Now, we are also making quite poor decisions as state by state and as a country in terms of reopening and our priorities. Condition precedent first for reopening schools is low community spread. And here we see rising cases as we head into the winter, and we are reopening parts of the economy ahead of schools. So in a lot of ways, we've signaled with our intentions, our funding, our resources, and our actions that schools are deprioritized, or getting kids back into school has been deprioritized. I am confident we can keep kids and adults safe in schools if we provide the resources for them in terms of the risk reduction strategies and the guidance for how to do it.
Okay, thank you. Building on what I said earlier, though, as we think about this more of a long-term problem, are there investments we should be making that are going to continue to pay off in the future, or would you continue to focus on, the three things that you've mentioned: hand washing, masks, ventilation?
Well, so no, there's a lot more we should be doing. Plexiglass will go away eventually, but there are things that shouldn't go away, these investments. Let me talk about, my team wrote a report before this one we wrote on schools and COVID called Schools for Health, outlining over 200 reports showing how the school building itself influences student health, student thinking, and student performance across what we call the 9 foundations of a healthy building. But because I've been talking about ventilation, filtration, and thermal conditions, I'll focus on those. So there are studies showing that when the ventilation rates are too low, you have kids who are absent more from school, more upper respiratory infections. We see they perform worse on tests. There's one study showing a 5% decrement in power of attention, equivalent to skipping breakfast that morning. We see they perform, when ventilation is higher, they perform better on word recognition and memory tests. Same things for thermal conditions in the building, influence on upper respiratory infections. If it's too cold or too hot, they perform worse on complex tasks. A major study out of New York State following kids for 10 years showed that if you took a test on a hot day versus a moderate day, you're 13% more likely to fail that test. Think about everything we do to prepare kids for these tests. And to think that what matters or what's going to drive their performance is how the building is performing in terms of ventilation and thermal conditions. So it's quite clear that these minimum standards we've been targeting that we're not even meeting the minimum standards are not even enough. We need a real broad look at holistic, healthy building strategies. My team has released a report on the 9 foundations of a healthy building. So these investments in plexiglass, sure, that's short-term investment, that goes away. I'm not even an advocate for plexiglass, by the way. But these investments in the building and ventilation, filtration, acoustical performance, that's an investment in student, teacher, and administrator health. Here's the crux of the problem, and I'll use an interview by Betsy DeVos from a couple of years ago on 60 Minutes. She said we need to be investing in students, not in school buildings. So of course we should be investing in students. But the last part of her quote shows the disconnect. We shouldn't be investing in our buildings. There's that disconnect that school building isn't really influential in driving student health, student thinking, and student performance, despite decades of scientific evidence that shows that's the case. So an investment in the school building is an investment in health promotion, learning, and performance.
Okay, thank you. I am continuing to bring in questions, so please do continue to submit them. We're kind of now looking more at the future. So Paul, I want to go back to talking a bit more about not just the investment in buildings, but the investment in other capacities. We've talked a bit about what we need teachers to do. There are many new things that we need teachers to do. We know from our own personal experience at the Harvard Graduate School of Education, the investments we had to make over the summer in professional development to prepare to teach remote, to provide supports remote. So there's a question about, what do we do in terms of teacher support and sustainability? And I want to also add to that, investments in professional development to prepare them to do all these new complicated tasks that we're asking them to do.
Yeah, urgent area of need for investment and time in building teacher capacity, because we really are asking them to rethink their role. And under the amount of stress that teachers are under right now, the tendency is to kind of revert to the mean, to revert to what you always used to do, because that's what has gotten you through thus far. And if we're going to ask people to work differently, we need to give them the space, the security, and the time to acquire those new skills. Now, I think in terms of what we can do for teachers, number one is, if we did some things that treated some of the externalities that are complicating teachers' lives, that in itself would relieve them to focus more deeply on teaching and learning. So if we made sure that everyone was connected to the technology and those families had the support they need, and you had the internet connection and they had the laptops or iPads or whatever they needed to be connected, that would be a big plus for teachers. If we did something more, as I was advising earlier, in terms of a holistic approach to treat some of the impediments that get in the way of young people being able to come to school. If everybody is fed, and we're clear that that's happening in this country, it should not be possible for people to be hungry. And so we've got to solve that. The mental health issues, which were prominent before COVID. Before COVID, the number one issue that would be mentioned to me by superintendents all over the country when asked what was the most pressing challenge was mental health. That's doubled and trebled as a result of this crisis. So dealing with those mental health or the health issues outside, we talk about healthcare all the time. Children should have healthcare, obviously. If not, they come to school traumatized and under toxic stress of one kind or another. So treating those would help teachers. But then we're asking teachers to work differently. So they're going to need more time, which is going to cost more money, and they're going to need a massive investment in professional development. And we saw, I mentioned it earlier, what happened to a lot of our districts this fall. They did not have the time or the money to do professional development in the summer. So in many of our states, we postponed the opening of school by a month, therefore guaranteeing learning loss of a month's worth for students so that we could do the training and development that should happen for teachers. Now, Bridget alluded to the Harvard Graduate School of Education, where I have the good fortune to teach. We had robust professional development all summer long, all kinds of interventions and coaching and group sessions. And then we get teaching fellows in the fall to help us do a good job, particularly those of us who need help on the technology and things of that nature. And they've made it easy for us to move more towards state-of-the-art teaching. I mean, when we all started in March, we were sort of in emergency mode and doing the best we could with this overnight transformation, which is the same thing the teachers in K-12 are doing. But many of our districts haven't moved much beyond that emergency mode to a state-of-the-art mode in online education. And until we get there, the learning gaps are going to grow, because those who have privilege and advantage are going to have access to other forms and modes of learning. And those who are totally reliant on the school system and are not in person and are trying to cope remotely with teachers who really haven't been trained to use it, teachers who incidentally are being asked to teach quote unquote hybridly, which means they're having to perform for an in-person class and simultaneously conduct class online with people, typically without any kind of assistance whatsoever. I mean, it gives me a headache to think about it. I absolutely couldn't do it as a teacher in this environment. I can't imagine how teachers can do it out there. Finally, I just think we need to inject some new roles into school systems. We need people who can connect with families. I do a lot of work with the city here, Boston, for example, and we get AmeriCorps volunteers, and I'm really a big proponent of the National Youth Service Corps, of getting young people out into schools to supply that technology knowledge and skill to families, to teachers, to students, to be the connective tissue between families and the school systems and the educators. I think we really need that kind of help. So I'd urge you to take a close look at National Youth Service as far as all this goes. So I think there are a lot of ways we can help teachers deal with this, but they need more time, they need more support, and they need us to do some things to mitigate the problems that are now superseding the educational challenges that they have to deal with.
Okay, thank you. So we're getting to the last 5 minutes. We've talked about a number of possible solutions, the importance of data, collecting information on lessons, sharing that information, resources, buildings, professional development, thinking broadly about capacity with involving youth. I want to give Paul and Joe the last few minutes to say and really hit the nail on the head. So what is the role for federal leadership? What can the federal government do, and the suite of possible solutions, because there are things that we absolutely can do, but what is the place for federal leadership? Who would like to take that first?
Sure. So I'll go, and so thanks everyone, and thanks Dean Long for inviting me to participate here. And I'm just going to reiterate some of the things or messages that I mentioned throughout my comments over the past hour. In terms of the immediate steps, I think it's entirely reasonable, prudent to supplement schools or provide them with the opportunity for a portable air cleaner in every classroom. It sounds simple because it is. This can go a long way into reducing risk. Another immediate action, we need to standardize this data collection in two different ways. One, we do not know the denominator here in terms of success stories. So cases will get attention. Dean Long has said this, we need to be sure we're collecting data so we understand from these thousands of little experiments what's working and what's not. It's a lost opportunity for right now and for mitigating risk into the winter, but also in thinking about future crises we face. So that's an immediate need. I would also say in terms of that data collection need is a broader collection of data. There are many districts with scorecards or benchmarks collecting information on cases and the control measures I've talked about in schools, which is good. But they're not collecting data or reporting data on things like attendance, completing assignments, stable internet, access to food. Do they have a caregiver? Do they have a quiet place to work? This will help inform our wider understanding of real exposure and risk. Is this hybrid model working? On hybrid models, I would mention that this has been something that many have pursued, despite the science saying it likely leads to higher risk. Because the social networks are actually wider in a hybrid model. So besides the teaching modality problems, from an exposure and risk standpoint, it's actually worse as well. So we need to do a better job on the data collection side for both of those, richer collection of data, and also capturing the success stories. Last, I would say is that longer term outlook is really thinking about how the government can set these higher minimum standards. I'll tell you, the standard I've been talking about is called the Standard for Acceptable Indoor Air Quality. How is it acceptable that our standard for schools is an acceptable minimum? It shouldn't be. We need a standard for healthier schools, not a minimum standard that targets some acceptable minimum set by engineers without public health scientists at the table. So thank you. I appreciate the opportunity to speak with you all today.
Great. Thank you very much. Paul?
Okay, I'm going to do the 2-minute drill here. I think there was a recent editorial, which I applaud in the Washington Post, about sort of put up or shut up. We need a Marshall Plan. We need a Marshall Plan for education right now. We're at that moment where it's critical in terms of human capital development in this country, in terms of our economy, and in terms of equity and racial justice. Schools cannot create an equal opportunity society by themselves. And we not only need to compensate for the immediate needs that have been well described here, but to build the architecture of a broader, bolder child development system, to redo ESEA and integrate HHS services and supports, and take into account the factors like healthcare, mental health, nutrition, internet, those things that we've been talking about today. Targeted investments, I'd suggest 3 areas. One, incentives for innovation and redesign of curriculum, of relationship building, the personalization I've described, embedding technology, closing the digital divide, moving toward more holistic child development models. Second, broadening our accountability measures and the data we track. This is part of that conversation, including measures to focus on children's well-being and factors like family engagement and the degree to which schools are encouraging and developing relationships. And finally, the topic we were just discussing, I think a massive investment in professional development, more teacher time, different roles, national service. They need help in technology, family engagement, applied and project-based learning, relationship building, personalization, things of that nature. So those areas. Basically, I think it's a moment in American history. This is the Sputnik moment for a Marshall Plan in this whole area. Incentives for innovation and redesign, broadening accountability, and deepening professional development.
Thank you very much. And thank you again to all of you for joining us for this hour. Special thanks to my co-panelists, Joseph Allen and Paul Revel. Also, again, thank you to the Harvard University Office of Federal Relations, Barry Walsh, Director of Editorial Strategy at the Harvard Graduate School of Education, and Jody Smith-Bennett, who's Associate Director of Engagement and Events at the Harvard Graduate School of Education. Thank you again, and have a good day.